Okay, so I believe it started recording, so then I'm going to hand over to Rujney.
Hi Lisa, I'm Rujney. I'm a special educational needs teacher, and a lot of my students have EHCPs as well as individual healthcare plans. Just to answer your question about where do you take this next, knowing your child's medical diagnosis, you when your child starts school on Wednesday, you straight away have a conversation where you can say you want to initiate a individual healthcare plan. But one question I wanted to ask, you mentioned that your daughter has ADHD. Does she have an EHCP plan as well?
Nobody's. This is the thing. I got the diagnosis. I went private. Luckily, through work, I pay for private medical insurance, and so I was able to have her tested privately. And I have shared all the results with the school, but they've not put. I have no plans in place for her, so this is like I don't know where to start, basically.
Okay, so if your child has been diagnosed with ADHD, you can take that to the local authority and they will action a EHCP plan, but that will take a little bit more time because it's evidence-based. So they other agencies will need to get involved, like the specialists, and then that's kind of a separate little section. But the individual healthcare plan, which needs to be actioned straight away and can be actioned straight away, is where you speak to the class teacher or the year group leader or the deputy head, and you just say that my child has been diagnosed with this, they've got a medical condition, I would like a individual healthcare plan put in place, action straight away, and they should do that. It is is something that they will do because they know the severity of your child's condition, and they do not want anything to happen knowing that information, because then they will be really responsible because they haven't done anything in place to make sure and support your child's condition. So you go and make that first conversation with deputy head, class teacher, and you say that we need to arrange a meeting where we can sit down and break down what my child needs to support their medical condition.
Okay.
And if there's any medication that is given, or and correct me if I'm wrong, Karen, but to measure the I'm not really medically trained, but I was just thinking that if you want to measure their heart rate, would that child maybe need something to measure that? Is that one of those things that they clip on the finger?
So clip on the finger is for oxygen saturations. So
Okay.
have they asked you to do any monitoring at home, Lisa? Or?
No, they haven't. Not
Yeah.
asked to do anything like that. And her medication, I've always given it to her about like 4:30, so she'll have finished school. So
Yeah.
I want to have them give it to her, if that makes sense.
Yeah.
So, yeah.
Can I show you the template that we've got?
Please.
Because that'll just help. But I'm Karen. So I am mum to Samuel, who's 15, and that's nearly 15. Sorry, wishing life away. Who has a heart condition. So we've had healthcare plans in school for a long time, and I'm also a nurse, but I don't work in the cardiac field. Okay, so can you see this?
Yeah, I can. Thank you.
Right, so I'm just going to pop the address of the website in the chat as well, so you can download this template, and you fill in as much as you can, and then this is yours to take to school and say, this is my child. School can support you in filling it in. Isn't that right, Rujney?
Yes, well, really, it's the school that should be filling it in. It should be a joint. It should be the parent and the school jointly collaboratively filling that out. It's not a point where the parent fills it all out and then presents it to the school. It's something that the school should be doing to support the parents.
Okay.
Yeah.
Yeah.
I mean,
They may even have, sorry, Karen, they may even have something very similar. So they may say, oh, okay, we can use this, or we can, you know, join it with our one. But they will have individual healthcare plan templates as well. But this one, I had to look at this, and this was really good because it covered every
everything.
area. Yeah.
Yeah, that is good, isn't it? Like,
and also on that website, it gives examples. So there isn't a cardiac there is a cardiac example, but it wouldn't fit your daughter's needs. But there are examples of how to fill it out and the things that you can include. So it has all the contact details. Although you're not given medication, although she's not having medication in school and you're giving it at home, I think it's also useful for them to be aware that she is taking it.
See, I think that.
And the other thing is,
sorry, Karen, I was just going to say, I know mum's given the medication at home, but I think not only, at least it's very important that support staff are fully aware of your daughter's condition, heart condition, and that they're all in the picture. So they look at it for any signs, any symptoms, they look at any changes, and they're able to have access to this individual healthcare plan, so they know what to do in a crisis situation.
Yeah, that makes sense.
And also it talks here about, does it affect behaviour or concentration, side effects as well. So I know there's been times in the past when my son's been on frusemide, so he has the frusemide at home, but it's then in his system for the next 3-4 hours, and it makes you go for a wee a lot more. So school had to be aware of that, to know that if he needs to go to the toilet within 10 minutes of arriving at school, you let him go. So it's things like that. It's thinking about how could that medication impact her during her school day, and that's kind of stuff that's useful for them to know.
Yeah, she's touch wood, she hasn't had any reactions as such to it. Good. It seems to be quite, like, it's not noticeable. And I have asked her, because they've also recently increased the dosage, so, which is good that it was while she was off. But yeah, she seems to be all right with that.
Good. I mean, some of these sections might not be applicable to you. So this one, it talks about monitoring. And I know when your child gets diagnosed with a heart condition, it's really tempting to buy all the machines off of Amazon and start doing it yourself at home. Don't
No.
do it.
No.
If the hospital tell you to do it, but don't get sucked into your own paranoia, okay?
Yeah, no, definitely.
That's the voice of experience.
You know what? I used to be like that when she was a baby, and she used to sleep right next to me, and I would still have a monitor on her, which was ridiculous. And that's the bit. It's taken me so long to get out of being that person.
Yeah.
I was like, I don't want to go back to being this neurotic mother that doesn't let their child breathe, because she doesn't want that. She's so independent. It's ridiculous.
Yeah, and I think the stage that we're at now is my son, you know, is thriving at secondary school. He's just done his Duke of Edinburgh bronze, you know,
Wow.
and you've as agonizing as it is for you as a parent, you've got to let them do it, because they need to grow into functional grown-ups who can live independently, and it hurts. I know it hurts, but you've got to be brave, and you've got to let them do it, and you do it safely. You put that safety net around them, but you let them go off and do it. Okay.
Yeah.
Can I just ask a question? When Lisa goes and speaks to senior management or the class teacher or both, they're going to ask the question, how are you measuring what, on a medical term, what your child can and cannot do? I mean, if Lisa goes and says that, oh, my child can do cricket, but you know, maybe not some other stuff, they're looking for some sort of like measure of a heart rate, or if they're, you know, sweating, or 10 minutes of exercise, and then that's it. I think there needs to be something a little bit more specific there for Lisa to take to the school, because I'm not quite sure they're gonna, that's for them as a teacher myself. If a parent came to me and said, oh, my child can do cricket, but that's it, nothing more than cricket. I wouldn't be able to measure that really. So what can Lisa do to best?
And I think that's where you need that email from your cardiac nurses.
Yeah,
The other thing as well, your clinic letters. Have you got anything written in your clinic letters about what she can and can't do?
Well, the most recent one is one that says that she can do cricket, riflery, whatever.
Yeah.
And it was more a case of obviously just not being struck in the chest, because all this, we got this, and then she went to school for 3 weeks. The school teacher had phoned me and she was like, oh, do you want me just to keep, what do you want me to keep her in the classroom at playtime? And I was like, well, no. I was like, because she needs to be let out, because so mad.
Yeah.
But I'll be honest with you, all this stuff which is so valuable now, at the time it didn't even cross my mind. So like I feel as though this is going to be really helpful going in this week, and like you said, to speak to the cardiac nurses and have something written down, because it's really hard, because that initial this is what we found was on a Friday afternoon at 4 o'clock. We kind of came out and we were like, okay, that's great, but we haven't asked those questions, so I don't have the written down, which is what I need quite clearly to be able to say, this is what we monitor. And like you said, it's the sweating. She drops colour. So I keep saying, like, I see that as a parent, but not everybody sees that. And it's like, it's hard because I'm not at school. So but I don't want her to lose out from the social aspect. So for her to be, keep that, I think that's so important as well.
And also the fact you said cheerleading were happy to adapt things and make them safe for her. That's fantastic, to keep it inclusive for her.
Yeah, they said that it just, where a normal 2-hour training session, for those 2 hours she wouldn't necessarily be active the full 2 hours where she used to be. It would be a case of she'd do the bits that she's able to do, and then she'd sit out on the sidelines while they practice the other bits. So they do want to help. I mean, I'm sure they also want my money as well, to be honest. It's not a cheap sport. So it's like so yeah, I think I'm definitely going to draw up that email and get them to really pinpoint about PE, because the consultant we saw originally said, oh yeah, just carry on, life is normal. But I feel like it's life isn't normal now. And I don't know when will it ever, will it actually ever get normal, basically.
Someone said to me, I felt exactly like that, and I think for me, I was still on maternity leave when Samuel got his diagnosis, so I didn't even have the normality of going back to work, and that was the bit that I craved. And I remember someone saying to me, it will feel normal again, but it'll be a new normal. And at that point, when you're in the thick of it, you just think, my life is never going to be the same. But I promise you, it does get better, and you will feel normal. I promise you. Okay. All right.
Yes, thank you.
You will get there. Takes a while, but you will get there, honestly.
Yeah, definitely. Oh, that's
Lisa, did you want to know anything more about the school aspect in terms of, do you feel confident enough to speak to somebody at school? Do you have a school nurse that you can talk to as well?
Well, I have to laugh because I've never seen the school nurse, and the whole ADHD thing. It felt like I don't know. It's, if you looked at Isla, she's outgoing. To look at Isla, you would never know that there was anything wrong with her. I think that almost gets lost a little bit because she sort of slides in, and then I think maybe this is why the first plan wasn't maybe put in place, whereas now I think I need to be the driver, and I think from this call, it really has helped me understand that I need to take the action and not wait on the school. Because I suppose a bit of me was like, well, surely they'd contact me, but I mean, she's 1 out of 300, so why would they really? And I get that. It's hard work being a teacher. I couldn't do that job.
I mean, they shouldn't. They should be very, very supportive, but you need to take it to them. Don't
Yeah.
wait on them to ask you. You be the parent that says, okay, right, this is what we're going to do, and if anything, just remember the Children and Family Act 2014, Section 100, states that schools have a duty to support pupils with medical conditions. So you just remember that. And if you need to put that in a sentence to them or an email, put it in.
No, that's good. Yes, that is, and I'm sure they will be, but like you said, it needs to be driven by me on how we do it. I had another question and it's just popped out my head. Sorry. What was I going to say? Oh, see when you take time off school for appointments and things like that. I mean, how does that go down in her absence? Because she had is that going to
No.
Lisa, that comes under authorised absence. It's an authorised absence. All medical hospital appointments are authorised. If she was just off, then obviously on her attendance it would come up as unauthorised, and it wouldn't look so good. But if they're medical condition appointments, hospitals, that's all authorised. She would not be penalised in any way based on her having to for her appointments.
Yeah.
Oh, sorry.
Oh no, I was just going to say Samuel missed more than half a term of school a couple of years ago because of surgery, and school were fabulous. Yes, he was under the school target percentage. No one mentioned a word to us. They did add him to the SEN register afterwards, but that was purely so that they monitored him on a regular basis to check he was achieving what he should and whether he needed anything extra. But no, absence doesn't matter.
Karen,
they do
was
not
that
matter.
Karen, was that secondary?
That was while I was at secondary school. So yeah, was So
yes,
don't worry. Don't worry.
Yeah, don't worry. Yeah, don't worry.
On slightly off topic, and I'm sorry if this is the wrong place to ask the question, but where do I stand on a work basis? Do you know what I mean? Because I've been taking holiday to cover hospital appointments. Is that right?
That comes under dependency, if I'm not mistaken, Karen. Would it come under a dependency?
It varies. So some of it will be parental leave.
Right.
You can claim, but in my experience, parental leave is unpaid. So I've often weighed up, do I take this as parental and not get paid, or do I use my annual leave? And that comes down to personal choice. Also depends on your employer. So I've had employers who have been particularly not helpful. And one hospital admission for me, I just went to my GP, and my GP was fabulous and signed me off sick. And that meant I carried on getting paid. Last time he had surgery, my current employer is amazing and said, take 4 weeks off work, we'll keep you fully paid, don't worry about it. So it's a negotiation with your employer. But I'd say if they're being awkward, your GP would be a really good source of help, and GPs are really understanding and happily sign you off sick so that you're entitled to sick pay, so you're getting something. It's not right, but sometimes you have to play the system.
And on the one of GPs, so we've had all this, I don't know what you're like, but GPs in Bristol are a bit it's a bit hit and miss what sort of service you get. But obviously we've got all this stuff going on, and we've all myself, my husband, and my stepchildren, we've all had to go for echo echos to make sure have the same. And I had to arrange it through the GP, but I found the GP was like, they just weren't very helpful, because I said, oh, is this something you see a lot of? And they were like, they just were really blunt and were like, no. But I was like, okay, so I almost feel a little bit like, should they be a bit more supportive? I don't really know what I'm meant to do with them. Should I speak to them or not?
The thing is with GPs, they know a little bit about a lot of things. So they're not going to have an in-depth discussion, in-depth knowledge on Marfan's, in all honesty. Again, I've learned over time the situations in which it's worth ringing my GP and the situations in which I would just ring the hospital straight off. And you learn that over time. I would always go to the GP if it's a normal everyday thing, like I think he's got a chest infection. And with his history, they're more cautious than other people. But if it's something that I think is primarily a cardiac problem, I will go to the hospital first. I don't go to the GP with that.
Right. No, that's fine. I'm sorry, that was off topic.
No, don't worry.
These questions are like, your answers are so like valuable to me just now. It's just, it's so nice to speak to somebody else other than my husband. He's useless. So this is good.
I'm just having a scan through if there was anything else in here that would be helpful. I also think about, I always say about the little things are helpful as well. So my example I always give is Samuel doesn't go outside when there's snow on the ground because he just can't handle it, and that's been in his care plan since he was at preschool. Like, don't force him to make a snowman; he'll just cry for hours. Yeah, so you've got a section on physical activity here, and then the other thing, eventually you're then going to be, looking at trips and activities away from school, but you'll get to that point. Don't worry, don't panic about it now.
I mean, if the individual healthcare plan is put in place, and then that will be carried and taken wherever he does educational visits. If she does educational visits, she may have a one-to-one at that time, and there's an educational visit just to make sure she's got that support. But having that created is your first port of call. Get that created, and then that will follow her through wherever she goes, and it's reviewed as often as you need it to be. If the condition changes or something changes, it's reviewed, but usually it's reviewed annually, but it can be reviewed as much as it needs to.
No, that's good. I was just reading the questions, so yeah, it is very in depth, which is good.
Yeah, there's lots in there, and I think some sections will be really applicable, some sections may not be applicable to her, and that's absolutely fine. And I was saying earlier that because this is now one document that's got everything in it, I have a copy as well. So say Samuel's Scouts have got a copy, if it's applicable to others. So cheerleading will be a good place if she gets back to cheerleading, that they can have a copy. So they've got all of the information they need together.
Yeah, no, it is good, and like I said, it's not even something that had crossed my mind before now. So no, it's very handy. Thank you.
Well, thank you for joining, Lisa. It's been a pleasure. I'm going to stop recording now, and then we can